Hello, this is Yoon, and this is my career project on physical therapy. Before we begin, here's a quick rundown of everything we will be going over. First is salary expectations, followed by working environment, job duties, academic requirements for the job, and an academic timeline based on my current academic progress, and conclude everything with a personal reflection of my strengths and weaknesses related to becoming a physical therapist. Starting off with salary expectations, the average entry level salary was $87,591 in Atlanta, Georgia as of October 11, 2024, according to ZipRecruiter. The median salary, according to the Bureau of Labor Statistics, on the national scale is $99,710 as of May 2023. Based off these figures, physical therapy offers a relatively stable and secure financial outlook. Moving on to working environment, physical therapists can work in a variety of settings, which can include hospitals, sports facilities, clinics, or they can even be self-employed. Physical therapists can work on a full-time basis, on a 5 8-hour day, or 4 10-hour day schedule. They can also work independently, one-on-one with patients, but often work as part of a collaborative healthcare team. The job can be physically demanding as they spend much time on their feet, moving between patients and leading exercises. In the facilities and offices they work at, they are usually surrounded by exercise machines, treatment tables, mobility aids, and other specialized equipment that must be maintained, cleaned, and organized. Tied to the working environment are job duties. It's important to note that duties will differ depending on where and what specialty a physical therapist chooses to work in. But generally speaking, physical therapists help patients recover from injuries, manage any pre-existing conditions, improve physical function, and prevent future problems from arising. A typical rundown of their day-to-day can include reviewing medical history or referral notes from other healthcare professionals, observing patient movements, and listening to any concerns that they have. After diagnosing and identifying any concerns, physical therapists can then develop personalized treatment plans which outline goals and expected outcomes and exercises that they are to do. Through exercises, stretching, and equipment, they guide patients through the therapy. In the same breath, they will also monitor progress and adjust the plans as needed. They will also communicate to and educate family members and patients of the recovery process or expectations. Some conditions that they work with and target are arthritis, cerebral palsy, and muscle strains. So now that we have an outline of what is to be expected when becoming a physical therapist, let's review the steps I must take to become one. First, let's review the academic requirements necessary to become a physical therapist. Number one on the list is a bachelor's degree. While there is no wrong or required major, the most common majors among physical therapist potentials include exercise science, biology, and psychology. This needs to be followed up by a Doctor of Physical Therapy degree from a Commission on Accreditation in Physical Therapy Education, CAPTE for short, accredited program. In the US, there are around 314 programs, which unfortunately GGC does not have. After earning a DPT degree, state licensure is necessary. While a residency, fellowship, and board certification are not academic requirements, there are available options to further knowledge and practice, or specialize in areas such as orthopedics, pediatrics, and sports. Now let's take a look at a more detailed breakdown. In this slide showing an academic timeline, we will review the steps I need to take to become a physical therapist based on my current academic progress. For me, the first step is to complete our anatomy and physiology 2 and microbiology. Then I would have to retake Physics 1 and Physics 2 with labs and retake General or Principles of Chemistry 1 and 2 with labs. I could finish these classes during spring and summer 2025, then move on to finishing my bachelor's and graduating during spring 2027. During this time of finishing the prerequisites required for a DPT program, I would also need to meet the requirements for volunteer work. Depending on the program, verification may be required by a physical therapist. For instance, for Georgia State University, they require verification and a minimum of 80 hours. Between junior year and early in senior year, I will need to take the Graduate Record Examination, or GRE test. For a quick breakdown, there are three portions of the exam: an analytical writing, which scores from 0 to 6, verbal reasoning, 130 to 170, and quantitative reasoning, scoring from 130 to 170. After meeting the required prerequisites, gaining volunteer hours, and taking the GRE, then can I follow up with an application to DPT programs through the Physical Therapist Application Service, or PTCAS, which is a centralized application service where you can apply with one application to multiple schools. And I will do this during early senior year. After graduating with a bachelor's, I will then complete a Doctor of Physical Therapy program where I'll take classes and gain clinical experience and finish within 2.5 to 3 years. After I earn a DPT degree, I must then pass the National Physical Therapy Examination, or NPTE, which is administered by the Federation of State Boards of Physical Therapy, or FSBPT, to become a licensed physical therapist within the US. Then I must follow with state licensure, and in Georgia, I must file this with the Secretary of State and renew this every 2 years. That sums up how I can become a physical therapist if I start this semester. And now this leads us to the final conclusion. Throughout this presentation, we have gone over salary, working environment, and job duty expectations, academic requirements, and the steps I need to take to become a physical therapist. But how does this career fit myself, and is it a viable alternative career option for me? Starting out with a personal strength relating to physical therapy, I'm the type to gain motivation when helping others. Having dealt with my own health troubles, I'm especially motivated when I can improve someone's health and well-being, even just a little. In becoming a physical therapist, I enjoy that I can see tangible results through patient progress and hard work. And I think this will in turn motivate myself and better the care I provide to others. Despite this strong motivation, I do have concerns about the physical demands of becoming a physical therapist. I have observed physical therapists lift patients out of their beds and support them during mobility exercises, which can be physically taxing. And I worry that there are people I have to turn away because of my own physical limitations, or that I will unironically need physical therapy myself in the future. But looking at another personal strength, I enjoy working with others, establishing connections, and witnessing the journeys that others take toward recovery. And I feel that my personality gives me the ability to listen and connect with individuals, which I believe can be helpful in understanding patient frustrations and fears. And from this, I can create a supportive environment where patients can turn in, feel empowered, and motivated to overcome their challenges. I believe I'm pretty good at communicating complex ideas, or in a physical therapist case, explaining treatment plans to others. On the flip side, while I understand the challenges patients face and believe that I can communicate treatment plans to others, I worry about being able to say or offer effective emotional support. I do often struggle with finding the right words to say, and I can say that I am a bit awkward at comforting others. But overall, considering everything that we have gone through, I believe that becoming a physical therapist is a good fallback option for me if I were to ever fall out of nursing. Thank you for listening to my career alternative on physical therapy.